So without further delay, I would like to introduce our opening remarks speaker, Dr. Rachel Novotny, to give a brief remark about the importance of nutrition in food security and health and well-being. Thank you, Rachel, for joining us.
Yes, thank you. Can you see my screen? I did prepare a slide or two for today. Did it pop up?
Yes.
Okay, great. Yeah, thank you. Well, thank you for the invitation, and I really want to thank you all for the work you're doing, bringing people together and working together to collaborate and think about food systems. I applaud you, and I think the new findings and the solutions are at the boundaries of where we are in our own units. So I think this is exactly the right thing to be doing. So thank you, and I look forward to working with you on this. I'm trying to go forward. So just to contextualize some of my thoughts in the groups that I'm working with, in specific our Children's Healthy Living program, but others that we're collaborating with, we're seeking to identify and support healthy indigenous practices while respecting nature, and really be inspired by and be thinking about the future. And there's no better way than to think about our children and their future and their the life that they're living, the food that they're consuming. So when we think together about why to care about food systems, talking to different sectors of us, of course, for food, of course, food is a very basic need. This is actually how I came to the field. I began in environmental biology and interested in the environment, and ended up being focused on food as a basic need as I was thinking about the environment and people in it. And I want to acknowledge that nutritionists also recognize water as a nutrient and a basic need. And so issues of water are certainly also very central to life and to food systems. And of course, we need food for health and for well-being. So
yeah, I don't know.
as we think about,
yeah, I mean, not about this job. I mean, not anything around this, but just like in general.
No, because that's not right. That's between her and.
okay, sorry. So as we think about food and the food system, and we think about influences, most people start thinking sort of close to what people eat and the immediate influences, and those are critical. But of course, many things influence those things. So there are many factors to consider as we think about what people eat and food systems. So in our chill activities, we like to use this social ecologic model for thinking about it. I mentioned starting with the individual and influences on what they eat coming from the individual themselves. But then also thinking about their influences, most notably when thinking about children, family, but for all of us, family, friends, our social networks. And then the organizations that influence us, that we spend time in every day, that are opportunities to intervene, but also are strong influences in maintaining certain ways of doing things. And then, of course, our unique communities around the world and their characteristics from cultural to physical. And then, of course, policies that we can that do affect us and that we can consider trying to influence to make improvements. So these are the areas in the CHILL program we consciously worked at all levels to make change, recognizing that any one level is unlikely, and the research has shown that working just at one level alone is unlikely to really move the needle as we want. So these are our results. So the CHILL program has been going on for about a decade now, and we have been able to see in our measures of child overweight and obesity an improvement in the prevalence of obesity gone down in our CHILL communities as compared to control. And the actual intervention was in this period of time, this 2-year period of time between 2013 and 2015. And happily, we went back and measured 6 years later, and it had continued to improve. So we feel like we're on the right track with finding systems that will sustain change and continue to improve change. But having said that, a complex intervention like this is not always easy to do, and is difficult to replicate by many people. It was very much a combination of community-driven ideas and ideas from the literature. The approach can be replicated. And in fact, the food parts that we measured didn't show real obvious changes. So we're now in a new effort to focus on the food system, to go back into the data with a focus on the food system and see through all kinds of modeling efforts, examples within the data set. This is over 11,000 children of kids whose food dietary quality improved, and their obesity status improved, and the circumstances around them. So a focus on resiliency, all the context in which kids are doing well, and that's the current work that we're doing. Some of you are involved in that in group model building activities with us, and we're doing other kinds of modeling, and that will be followed by some strategy pilot activities. So as I say, we're doing further analysis of the CHILL data and using those models to then test different individual strategies to push the food system along towards greater resiliency and nutrition security, using our children as our models. And this is involving new methods for us, system dynamics. We've got new partners and collaborators for new ways to see these things and think about these things and build models that hopefully will then be able to help influence policy, that we can demonstrate changes that can be made. And so we look forward to working with students and community groups to test these approaches. We have 5 graduate students working on this, and we'll be offering some small grants to work on this. So we look forward to working with many of you. So this is our analytic framework that we're focused on in our grant. This is drawn from an FAO model, Food and Agriculture Organization model, focused on child diet and health outcomes, and looking at behaviors, food security, and environment. These are data we have in orange. These are CHILL data to address this. And the yellow are some that we don't have that we're trying to collect now to include in our modeling. So we look forward to working with you. We are anxious to continue to find ways to work together, pull together our data sets. We're more and more looking at combining data sets with others, and partnering wherever it makes sense. So again, thanks for the work you're doing, and that's what I've got for you today. Aloha.
Thank you so much, Rachel, for sharing. That's very interesting work and encouraging, as we saw some messages in the chat, to see the systems approach that your group is taking to address this issue across the Pacific.